Hello and welcome. If you are watching this, you probably have a child that's facing a stay in the hospital. If that's the case, you're in the right place. In the following presentation, Diane Pope, one of our hospital family support workers, will take you through information that we hope is helpful to you in the time to come. I will let her introduce herself.
Thank you for that, Matilda. It's lovely to be here today. So some of you will know me and some won't. So for those that don't, I'm Diane. I have worked, just a little bit of background so that you understand where I come from in sharing this information with you. So I've worked as a family support worker and a hospital play specialist for the Childhood Eye Cancer Trust in London for many, many years before emigrating to this beautiful country, New Zealand. And at that time, when I came here, I spent 14 years working in children's emergency at Starship as their hospital play specialist, and was also part of the education team of hospital play specialists at Starship Hospital before moving on from there and going back to my roots in working for a smaller charity and working in the area of family support. So I'm sharing with you over 25 years of experience in preparing children and families for hospital procedures in acute and long-term settings. So hopefully that little bit of background about where I come from and the knowledge I bring is reassuring. We're going to look today, so a bit of an outline for you, at why we need to prepare our children for hospital experiences and procedures, what that means in terms of their ages and stages of development, some language considerations, because sometimes it's quite hard to find the right phrases for what we want to discuss with our children. And we're going to have a small but really important focus on siblings. And we'll look at some tools and teamwork and how we can all do that together. So why should we prepare our children for hospital procedures? Well, if you think about this new experience or a second visit for a surgery that a child might have, preparation is a really good time to help children master something that could be challenging. It's a perfect opportunity to provide a time for a child to get ready, ask some questions. When are we going? Why do we have to go? Are you coming too, Mum? It's a time to identify things that they're worried about, any stresses or things you can avoid that might make it easier. It's a time to practice. Shall we pop on your new pajamas? Are you going to wear these ones? Oh, you'll wear these at the hospital. I'm going to practice some of my breathing because I know that keeps me calm when I feel anxious. And it's time for the family to work as a team. So the team at home, those that are going to be in charge of other brothers and sisters, and those that are going to be in the hospital environment, all coming together to make this as successful as we can. And it's a really important time for children to organize their emotions and to make meaning of these events that are to come. So they're the key reasons of why we need to make sure we prepare our children. There's lots of ways that you can do that. You can do that through play, reducing anxiety through reading books. You can enhance your children's understanding by role playing, and we'll have a list of some resources, etc., to go with this that you as parents can tap into to use for and with your children. And it's a great time to give jobs for everyone. So grandma's going to hold the fort at home. She's going to make sure that Johnny and Billy are well looked after. And you at the hospital, your job's going to be to have your new heart fixed and to practice getting better really quickly and use the playroom a lot. So yeah, just a chance to identify some jobs, make sure children are understanding what's going to happen, use some stories or some role play to reduce their anxiety, and really key into those key strengths that your child has, how well they cope with certain things, and those other opportunities for looking at things that they find really stressful. Preparation begins at home, which is great. So every family member can be part of that. And one of the most important things for our tinier children and those still wanting to take their soft toy or cuddly to bed is what we call their transitional objects. So when you're packing your bag for the hospital, make sure you include your child in this. You might want to buy a new small $2 shop gift to pop in the bag for after the surgery or procedure. You might want them to help you pop their nappies in, or choose their favourite pyjamas, or a pillowcase to have on their pillow in the hospital bed. So packing the bag is something you can do together, and make sure you pack the cuddly or the lolly or the favourite transitional object. It's really important when we're facing a more challenging situation that those objects and things that give us comfort are able to be taken with us. Hence it's referred to as transitional. And play is really, really important as a means of preparation. So this could be a hospital role play corner in your home. It could be some storybooks that you add to the library on going to hospital. And again, you'll find those in our resource list. It could be some puzzles with a thermometer and a stethoscope that a child who likes doing puzzles can play with. And remember that play is really important even if you're a teenager. So when you're playing a game on Scrabble or just having a chat using the PlayStation, they're great times to just open up those conversations. Any thoughts on going to the hospital tomorrow? Worried about anything? Have you considered some of the stuff you want to take? So while you're playing with a teenager, you can start those conversations. And timing. Timing is really important, and you guys are the experts in knowing your children the best. So you'll know if you have a child who's a real information seeker and likes a long lead-in time for something new that's going to happen, and you'll know that 2 or 3 days is a really good length of time to get your child ready and start to pack their bag. You'll also know if your child is a particular worrier and that you've noticed in the past that works well, say, in a new school situation, is if you keep the lead-in time really short. So you just tell them a few hours before what you're going to be doing. So at 10 o'clock this morning, we're going to grab a plane and we're going to pack our bag and we're going to go to the hospital. So think about your timing in terms of your child's coping strategies. Think about your children's age and stage of development. We've already touched on coping styles. Keep the information really simple but factual. And if you're asked a question, answer the question, but don't add additional information. So that might look like, how long will we be at the hospital? You can answer, we've been told it will be 3 days. You don't need to add, we've been told it was 3 days, but last time it ended up being 3 weeks, so who knows? That's too worrying, and that's not what they asked. It didn't ask, Mum, can you share your thoughts about how you feel and what if the time length changes when we're there? They simply asked you, how long will we be at the hospital? So try to keep your answers simple and factual. And consider who in your family needs information and at what stage of development they're at when you give it. And we'll have a look at that a bit more in depth now. So children from birth through about 2 years are in a sensory motor stage of development. So they learn about the world through their senses and the manipulation of objects. So in a hospital setting, that might look like a child who has seen the doctors with a stethoscope or has watched someone take medicine a lot, and they might pick up a little block and give that to their teddy as a way of giving them medicine. And they might make some noises and sounds around that. They might, or you may have a toy, medical kit at home, and they may just pick up the stethoscope and chew on it a lot, not because that's what happens with it, but because they're exploring things with their mouth, and that's what they do at those ages. As children move on, they'll move into their pre-operational stage. So this is ages 2 through to 7, which is a huge developmental stage, but it's a time when children are developing their memory, so they can remember things, but also their imagination. So they're able to understand things, and they're able to think about what's happened in the past and what's going to happen in the future. And they're able to have the most dynamic imaginary games. And this is great for setting up all the teddies and taking them to hospital, and talking about anaesthetic through using a mask, etc. And just generally having a lovely, Teddy went to visit the hospital time with them. And as you do that at 2, this will become more elaborate at 3 and 4 and 5 and 6 and 7, but it's really important, and they just love to get involved in that imaginative play. It's also a time when children can think about things going forwards and backwards, so that time factor is something you can introduce them. As children reach their concrete operational stage of development, again a wide range, aged from 7 through to 11, children become much more aware of external events as well as their feelings and others' feelings. So they become less all about themselves, and they begin to understand that not everyone shares the way they think or the beliefs or feelings that they have. So again, a really change in developmental stage. And last but not least, those children age 11 and or older, during this stage, children use lots of logic to solve the problems, and they can view the whole world around them, and they can plan for the future. So you're seeing that development from a very sensory, insular, all about me, slowly working through stages as children view the wider world. And it's important just to bear those stages in mind when you're thinking about preparing your children for hospital. One thing I'd really like to touch on is making sure our information is age appropriate. So first we're going to have a look at information that our children are told, and then we're going to move on to some language around that to help you. So when we give children information, the top tip I have for this is think about their age and stage of development, and think about what it is they're going to be facing in hospital, and use this general rule of thumb. So if your child is 2 years old, think of 2 pieces of information that you want to convey to them. Now, remembering children in the 2-year age bracket are in that sensory motor phase. So they are thinking about the world around them in terms of who's close to them, what do I need, and how will I manipulate things and make sense of them. So we're going to tell 2-year-olds that we're going to pack our lolly to go to the hospital, knowing that those children like that physical comfort, that sucky cloth, etc., and that they're really important to be well attached to their primary caregivers. So we're going to take your lolly and pack it in our bag for the hospital. And the second piece of information, Mummy's going to come with you when we get your heart fixed. Just 2 pieces of information is absolutely all the main points you need. When your child goes on to be 3, 4 or 5, we increase that amount of information, 1 new piece of information, roughly speaking, for their age. So if you have a 5-year-old going to hospital, we're going to pack a bag tomorrow because we've got to get ready to go to the hospital. John and Billy are staying at home with Grandma, and she's going to look after them really well. Mum and Dad are both coming to the hospital with you on this visit, and you'll be having a procedure for your heart to make it work better. What else would you like to know when we go there? So you can see how we've changed from our 2 pieces of information at age 2. We're going to pack our bag, Mummy's going to stay with you, to this much wider, broader range of information. And the same goes if you've got a child who's 10, you're going to tell a much more detailed story around what's happening when you go to the hospital. So I hope that tip and that visual reminder is helpful. We are also going to make sure that we revisit the information we tell our children. I generally say, as a rule of thumb, do this around an anniversary, not on their birthday, but near to their birthday. So think about what you told your 2 or 3-year-old, and then when they become 5, think about how you need to revisit the information, have a check-in with them, set a time, do it regularly, make it a big deal, but just have a really honest conversation with them about, hey, do you remember last year when we went to the hospital and these 3 things happened? I just wanted to check that you understand that all, because you're a bit older now. So just have a revisit and see where they're at and see what they know. There's never a perfect time to do it, but there are some appropriate times. So don't do it when you've got a house full of other children and lots going on, an exciting birthday event about to happen. But find a quiet time, make it casual, no big deal. And again, remember to answer the questions they ask you. Don't elaborate too much on the answers. Simply keep it to giving the answer to the question that you're asked. And if you're not sure how to answer a question, just own it and be honest. Now, I don't really know the answer to that. Let me ask someone that can help us, and I'll come back to you. And just in terms of preparing our children, remember that when we do prepare our children, or when there's a lot happening in a family, children do pick up on those overheard conversations. So I thought I'd use this as a nice little example to share with you. So when I worked in Auckland at Manukau Super Clinic, when I first arrived here for a really brief time, just a short contract to get myself in the workforce, I worked in a day case surgery there. And I had a little boy come in. He was 5 and a bit years old, and he'd come to have a circumcision. So it's my job to prepare him. He'd not ever experienced hospital before, and he needed to have an anaesthetic. So I did the preparation. We used some age-appropriate books and some information. We talked about going to sleep, and I used some age-appropriate language around that. And his mum was with him, a big chat, and he was all prepared. I answered his questions, and he was able to recount what was going to happen to me, and he seemed okay. So we continued to play, and we were actually playing with a Connect 4 game, not that we were playing it properly. He was filling up all the colours in the little slots, and I was filling up all my colours, and then we were mixing them up and just using the toy in a way that he wanted to. So all was going well. Mum mentioned that she was here on her own, and as we were chatting about that, the anaesthetist came to talk to her, and the anaesthetist talked to the mum about some pain relief for her son and how he'd have an epidural so his legs would be a bit numb, and how long he'd have to stay after the surgery before they could go home. Mum asked a practical question. Will he be able to walk afterwards, because my car's quite a long way in the car park. I'm not really sure how I'd get him there. He's quite a big lad. The anaesthetist told him not to worry, they provide a wheelchair. So in my psychosocial, looking at the mother and the family and the child mind, I'm thinking, oh, this is great. Mum's been able to connect with the anaesthetist. She's got the information she was worried about. Little boy here's all well prepared, etc. At which point, my little 5.5-year-old patient looked up and said, are they going to cut my legs off now too? So there's a lovely example of just how children hear things and maybe misinterpret some information we've given them, or maybe have some misconceived ideas, or have formed a notion about what they think will happen as they've overheard some conversations. So it's really important to revisit your information to make sure you've dispelled any myths or preconceived ideas. So hopefully that example highlights that for you. Language that we use. We like to offer some advice on using some softer language with children, but always remaining truthful. the way, if you use softer language and you remain truthful, you'll build trust with your children. So instead of saying, talking of injections, instead of saying we're going to get a shot, imagine little children might have heard about shotguns or shooting, or watched a program or listened or heard, particularly if you come from a rural area, they might have shot the pigs or whatever. It's just a normal, natural thing of life. So if you say, right, when you're at the hospital as well, you get your shots, you can imagine some of those preconceived ideas that were around in our children's heads. So I advise you to use the word injection. Even though it might not seem like a softer idea, it really is, because then you're able to follow it up with the idea that, with the clarification. So while you're at the hospital, we'll also get your immunizations or your injections. That's just a way that the doctors use to give you some medicine to keep your body safe from becoming ill. So yeah, using softer language is really, really important. So some examples for when you're talking with your children. So instead of saying, you'll be put to sleep, sounds like what the vet might do when the dog or the cat is sadly really unwell, and we don't want children thinking that. We tend to advise you to say, you'll be given some medicine to help you go to sleep. It's a different kind of sleep to the sleep you have at home at night. It's a deep sleep and a hospital sleep. And when your procedure or when your operation is finished, give you some medicine to wake you up again. So that's that differential between what is a normal relaxed nighttime, the night, bedtime, you're off to sleep, and what's actually going to happen in the hospital. Another idea some people are saying is you'll get some gas. Sounds frighteningly fearful if you're 4 or 5, or if you're 9 or 10, you're like, you what? Get some gas, like the gas fire? Like, what is this? And again, it's easy to explain and truthful. This is some medicine that you breathe through a mask. And you can perhaps get one of these masks when you're at the hospital, so you can add it to your hospital corner kit and play with that at home. Often, lots of our children are having open heart surgery. And whilst parents might not say they will cut you open, sometimes our big brothers and sisters do. You're going to the hospital to have your surgery and they're going to cut you open and fix your heart, which is great, because it is what's going to happen, but there's a nicer way to say that. So we like to encourage you to use the phrase, the doctor will make a small opening while you're asleep and fix your heart, and then close the opening for you. So you can see there some lovely examples around remaining truthful, building trust, and using softer language. So I hope that's helpful for you. Now, I wanted to touch today on siblings. Siblings of children who have a heart condition are often an overlooked group. And I know you will feel that as parents within your family. And so just some tips on when you come to the hospital, how you can prepare your siblings too. So my number one piece of advice would be to find someone for everyone. So if there are 3 children in your family and one of them's coming to hospital and there are 2 others going to be staying at home, find an important special adult. It could be a teacher, an aunt or uncle, your neighbour, the best friend's mum, Johnny from the football club. Just find someone that is really special for each of those individual children. Someone that can turn up, afford some extra time with your child during the time you're away at hospital and make them feel special. Have someone to talk to, someone to confide or confess in, or someone to kick a ball around on a Saturday morning. So your children will really benefit from that special relationship. And every time, if you have to go to the hospital in 2 years' time, a year after you recently went, asking those special people to be in it for the long haul. Each time you then come to the hospital, you can prepare your siblings by saying, and remember, John will come round again. You always go to football on Saturday mornings with John when we go to the hospital. It's just a lovely, special relationship to encourage. Use your support people. Say yes to the neighbours that offer meals. Don't hesitate to think about who's in your network. Ask one person to update everybody that needs an update on how the sick child is doing, and ensure that those support people that you've allocated to your children left at home, speak to your children first, those siblings, before they hear from someone else what's happening for your child. Make sure your siblings hear first. Recognise bad days for siblings of hospitalised children. Some days just suck when mum or dad or aunt or uncle are at the hospital with John and it's my school athletics day. And I just want mum and dad to be there. It sucks. And recognise that and talk to them about it and say, this really sucks. You're really upset about this. And if I could, I'd change it, but I can't. But I want you to know that I know how much this sucks. Just simply recognise it. Acknowledge the tough stuff is really, really helpful in allowing your children to feel heard and feel seen, and know that whilst things are difficult for you and the other child at school, they're also really difficult for those children left at home. But also recognise that some of this sibling situation, when you have a hospitalised child, comes with benefits too. There's extra treats. There's you get your favourite meal on Wednesdays at grandma's, and you're not normally allowed to have pavlova and a chocolate biscuit after dinner, but she always lets you. Recognise that there are bonuses, just like there are in every family, that don't have to incorporate coming to hospital. Keep your routines as much as you can. Ensure that after school activities still happen if it's possible. Bedtime still stay at the same time. All those normal routines will help children left at home, those siblings, feel secure and confident. And while you're feeling secure and safe in your routine, you're able to manage those more difficult days better. There's just some sort of safety foundation to the day. Things will be different. That's just the way it is. But your children, those siblings, they really will amaze you. They're 100 times more resilient and adaptable than we think they are. And just normalise their experiences, and you really will be amazed. I'd like to encourage you all, as most of you come to Auckland for your open heart surgeries and your procedures, to check in with your hospital play specialists. Your children can never be too old or too young, and there's never a wrong time. The tiniest babies are offered snoozle and relaxation sessions in the playroom on Ward 23B and at bedside if they're not allowed out of their rooms. From toddlers through to teens, there are age-appropriate activities and opportunities to prepare for whatever procedure is coming up, and your play specialists in the hospital have specialist knowledge in preparing children for cardiac and cardiology procedures. So please touch base with them. They are there to help, and they want to help you to help your children be as best prepared as they can for all they need to face in the hospital. And that just brings me to the end, and I want to take this time to thank all the Heart Kids and their parents who gave us their permission to share their photographs with us, with you, within this presentation. It was some difficult and important times in their children's lives or their young adults' lives that they were asked for permission for these photographs, and each photograph is a very important time on each of these children and young people's journeys. So our heartfelt thanks for giving us the permission to use these photos in this presentation and to share them with you. Thank you for listening. It's been a pleasure. And if you have any further questions, don't hesitate to get in touch.